views and opinions expressed in this program are those of the participants and do not necessarily reflect the views of BronxNet or the program underwriters.
Good evening. I am Errol Schneer, Bronx Lebanon Hospital Center's Vice President of Planning, Marketing, and Public Relations, your co-host for tonight's Healthbeat television program. We welcome you, our many viewers, to Healthbeat, and as always, encourage you to continue participating in the program by calling 718-960-7261 with any questions you may have. That's 718-960-7261. And we promise to do our very best to keep you medically informed and healthy by discussing the topics that are of interest to you. Please tune in every Monday evening from 6:30 to 7 p.m. on Channel 67, and you can also find out more information about Bronx Lebanon and its many community services online at our website, bronxcare.org. Tonight, my co-host, Dr. Milton Gums, Bronx Lebanon's Vice President and Medical Director, and I we'll be discussing pain management with an additional emphasis on the opioid crisis in our Bronx community. Sadly, and according to the National Institute on Drug Abuse, more than 90 Americans die every day after overdosing on opioids.
Yes, Errol, it is clear that something must be done about the crisis situation. And joining us this evening are the Dr. Douglas Reich, soon to join us, Chairman, Family Medicine, and Mike Slizinski, Practice Administrator for Bronx Lebanon New Comprehensive Pain and Integrative Healthcare Program.
Okay.
Both of these panelists are experts in the pain management field. Dr. Reich, could you sit down, please, before we come and get you?
Good evening, and thank you.
All right. Now, before we hear from Dr. Reich and Mr. Slizinski, let me encourage you, our viewers, to call in with any questions or comments you may have. The number to call is 718-960-7261. That's 718-960-7261. And please call us. Now, before we get into detail, Dr. Reich, about the pain management program, let me ask you to provide our viewers with an overview of the opioid crisis, particularly in terms of our Bronx community.
Thank you very much, Mr. Schneer, Dr. Gums. Thank you for having me on the program this evening, and I'd be more than willing to share with you some of the details that have occurred across the United States, as well as in particular in the Bronx. As we know, and as you just mentioned, 90 people die each and every day. Over 50,000 people this year will die of secondary or due to a drug overdose, and in particular narcotics, opioids.
That's an incredible statistic.
Yeah, it really is. You could take it a step further. It's almost more people than died in the entire time during the entire Vietnam War. So those vets out there who experienced that can put that into perspective. And it really is devastating. And as we know, of course, addiction, drug abuse, whether it's alcohol or drugs, not only affects the individual who is addicted, but it goes beyond that. It affects the family members, and it affects the community in many, many ways. So it really is an epidemic and a sad situation that we're experiencing in the United States, New York City, and the Bronx. I like to use a saying, a word that actually is used in AA, and it's no blame, no shame. And what I mean by that is that the truth is that there's no one to blame for this, either an individual who's addicted,
right,
or a community or a nation. And there's nothing to be shamed or shameful about. But rather what we need to do is to take this, this epidemic of opioid abuse and addiction and grab it and do something very dramatic about it.
But that's easier said than done, because most of the people who see an addict or someone who's committed to that they make them feel worse than they really should feel.
Yes.
And that goes on.
Well, Dr. Gumbs, I would respond to that in the following ways. We need to look at addiction as a disease, just like we look at any other chronic illness, such as diabetes.
Yeah.
Diabetes you don't cure overnight, nor do you cure addiction overnight. And it truly is a disease. You need, and once you accept that, then the idea of saying it's your fault, you no longer will say that. So in the Bronx in particular, you asked about that. It truly is devastating to many of our communities.
Right.
And we see it in our practices. Other health facilities in the Bronx and throughout New York City see this coming forward in so many different ways. And what I mean by that is that, again, we see the folks that are sadly and unfortunately are addicted, and it affects our economy also. Not only does it affect the way our health, but it also affects the economy. People the money is being directed in, to pay for drugs.
I'm going to ask you the question that's here,
Please.
but I think you answered a lot of it already. Expanding on Mr. Schneer's question, maybe you can provide our viewers with a definition of opioids, with a specific definition
Of the drugs that are
drugs
involved.
that are involved in this medication.
Sure, I would be happy to. And first, thank you, Mr. Schneer and Dr. Gumbs, for allowing me to join you tonight. Opioid is a classification of pain-killing medication. It's one of the moderate to severe levels of that drug classification. The brand names are oxycodone, Vicodin, Oxycontin, and they are highly potent and highly addictive medications that have become more and more used not only medically but also recreationally.
Yeah.
Now, how does addiction to these drugs occur in the first place?
Just take one or two.
Yeah, it really can start small. It can start with a couple of medications, a few pills here and there, and then if you feel your pain is not subsiding, it leads to another pill, and from there it's a very quick increase to that level of addiction.
Yeah.
Dr. Reich, what can individuals do to stop taking them?
Well,
Or to get off their addiction?
No, that's a loaded question, and the answer is quite significant. It's quite large. But first and foremost, they need to be in a program. They need to be willing to accept help, and willingly so. So, the first step at Bronx Lebanon Hospital Center, we're fortunate that in our Life Recovery Center, we have a very active detoxification program. So someone who's addicted to opioids and significantly addicted, they can go into the 3 to 4 day detoxification.
Right.
After that, you then absolutely need rehab. And rehab is not, a lot of people believe that rehab is 28 days because that's often the court-directed penalty that you need to go to rehab for 28 days. Rehab is not a 28-day process. It is a lifelong process.
Right.
And you need a formal program much beyond 28 days. Many people will say when you're addicted to opioids, it's a year-long program that you need to be involved in, whether it's inpatient or outpatient, some recovery program.
Yes.
So,
you have said most of what I'm going to ask, but I'm going to ask it again
go
because
for
it's
it.
very important. What are the therapies that you and your team use for patients that struggle with the opioid addiction?
So we've recently introduced several different therapies, some of which are brand new to the Bronx community. There's alternative medications, one, outside of the opioids. What we have done is added in acupuncture. That's becoming a very popular and growing field. We also offer OMT, which is osteopathic manipulation therapy, a type of hands-on treatment. We have a part-time physiatrist who does muscle and bone evaluations, and he does joint injections for us. And we're also looking to expand into other modalities.
Let me ask you a question that's
Sure.
not here. Patients that you see, how often are they committed to the therapy?
So it's a little bit of a struggle, and it takes a commitment from our end. It's something we have to approach them several times. One thing we do, we offer an orientation, a group therapy and discussion to our patients, and we require that all patients attend this orientation so they get the same message from not only their provider, but from the staff and from our behavioralists who run their group meetings.
Yeah. And you got a good response?
Yeah, I would
Percentage-wise?
say after 2 or 3 conversations with patients, we get a very positive response. Patients have come to understand it's on the news, the opioid epidemic,
Yes, yeah.
and they respond fairly well.
Yeah.
I would add, Dr. Gums, to this that if the first important issue is to to broach the conversation. So if you ignore it, or if you put someone who has an addiction and you say it's their fault, that's that's the problem. So what we do, and what most people do that are in addiction therapy, addiction medicine, that's the first step that they take, and that is, hey, let's have a discussion here. Are you ready? Are you willing? Are you interested? If not, it's okay, but let's talk about what that looks like. So, because we do know that it's a series of steps. It's the addict's ultimate decision, that they have to take that first step and that commitment.
Now, in terms of the emotional aspects, does your program deal with that as well? And how do you first use the emotional aspects and then the medical aspects? How are they tied together?
So for emotionally, we have 5 therapists on staff, and our patients all require to see those therapists at least once, and they handle the emotional really aspects to dealing with this medication and going into tapering and alternative treatments.
Okay.
Yeah, it's totally integrated. I mean, and that's the thing that we've come to realize. You can't ignore, it's an integration of the medical, the psychological, and the social, and you can't ignore one or the other. The medical being the addiction, and the withdrawal, and the craving once you have withdrawn. The psychological, of course, that's a craving, but it's also sometimes you have personality or mental health issues you have to address. And then, of course, the social. If someone who has an addiction is living in unstable housing conditions, you have to address that also. You have to get them somewhere where they can feel comfortable in their daily life. Really, it's totally integrated and intertwined. And we're addressing all of those issues through our behavioralists, our physicians, our physician team, our social workers, as we mentioned.
I'm going to ask you a question that bothers me. Can individuals that are prescribed the medications develop a tolerance for them, and what period?
So historically, I'm going to take a bit of a leap here, Dr. Gums. Over the last several decades, sadly and unfortunately, physicians were prescribing, physicians were prescribing opioids, narcotics, in excess and inappropriately. Fortunately, over the last 3 to 5 years, many New York State, as well as many other states throughout the nation, have made it progressively more difficult for physicians to do that. We have to report when we prescribe a pain medication that has an opioid or narcotic in it. And so now we're moving in the direction where physicians aren't over-prescribing. How long does it take? Well, you can do an abrupt withdrawal from a narcotic in hence the detoxification process, 3 to 5 days. Usually the most abrupt or difficult withdrawal symptoms are in that 72-hour time frame. But again, as I mentioned earlier, once you get through that acute detoxification, then the rehab and the recovery is truly weeks and months. Those triggers that occur can happen years later. You're walking through an airport, and that might be a trigger. You go back and visit mom, that might be a trigger. So it's a lifelong effort.
Now, in terms of the recovery process itself, just what is your success rate?
So it's interesting. Again, the numbers are interesting, but our success rate with helping people decrease the amount in our pain management clinic, in decreasing the utilization of opioids is over 50%. So over 50% of our patients who commit to coming in, so we are able to decrease or completely come off of their opioids. And that's really quite significant and substantial. I know, Mike, you were just down at the APHA, the American Public Health Association, participating in a presentation there regarding our data.
Yes, that's exactly right. I was down in Atlanta at the huge national APHA conference and presented exactly some of these numbers. And to be a little more exact, 64% of our patients are not prescribed opioids. To take it a little step further, that's not because we're turning patients away or we're refusing to give them medications. Our numbers have also increased at the same time, where we've seen a 20% increase in the number of patients coming to our clinic year to year.
Yeah.
Okay, well, let's now pause for a short break, and when we return, we will be asking you a lot of questions about your new center that's expanding and enhancing the care for people with pain problems. And once again, let me encourage you, our viewers, to call in with any questions or comments you may have. The number to call is 718-960-7261. That's 718-960-7261, and please call us.
At Bronx Lebanon's Women's Health Center, its labor and delivery unit, and Center for Gynecological Care, services are provided in a welcoming environment.
Women in the Bronx can always depend on our OBGYN team for expert, compassionate, and highly specialized care. We deliver the best in women's health services.
And high-risk pregnancies can also result in the delivery of premature infants. Thanks to Bronx Lebanon's neonatal intensive care unit, these babies are winning their battles for life.
We have saved thousands of babies throughout the years. There is nothing more satisfying than knowing that because of our care and attention, they can live their lives to the fullest as healthy young adults.
For women with gynecological problems, robotic as well as other surgical procedures and treatments are available.
I can tell you that the sophisticated surgical procedures that can be accomplished with the robot offer women in the community the benefit of smaller incisions and a shorter length of stay.
Bronx Lebanon is also taking women to heart in treating cardiovascular disease, one of the leading causes of death in women.
In our cardiology areas, we evaluate our female patients to assess their risk factors for heart disease, including high blood pressure and cholesterol.
Winning the battle against breast cancer represents another crucial challenge.
At our breast cancer center, we've implemented a comprehensive approach that involves exam, imaging, and biopsy, which is clearly succeeding in the detection of early cancer.
When illness occurs, Bronx Lebanon's nurses are providing excellent and compassionate care. In the ER, we see some of the most dramatic examples of the Bronx Lebanon team in action.
A high percentage of the patients seen in the emergency department are women, and we are sensitive to their needs. But what is also important is that our ER is helping patients overcome all types of emergency situations.
Diabetes is another problem that impacts many women, and Bronx Lebanon is taking an essential leadership role in controlling this disease.
We are empowering our patients and the community to recognize the symptoms of diabetes, seek help, and improve their quality of life.
And keeping its female and male patients moving in the right direction is Bronx Lebanon's Department of Orthopedics. Positive results are also being achieved for women wanting to improve their appearance.
Our board-certified dermatologists are experts in treating skin conditions and helping women look their very best.
And with the completion of its Health and Wellness Center for Ambulatory Care, Life Recovery Center for Chemical Dependency, Bronx Lebanon is positioned for continued success.
Welcome back to Healthbeat. We come to you live on BronxNet every Monday evening from 6:30 to 7 p.m. Please call us at 718-960-7261, and we will certainly do our very best to answer your questions. That's 718-960-7261. And before we continue our discussion, I understand we have a telephone call from Martha. Martha, you're on the air.
Martha?
Hello.
Can you hear me?
Yes.
Hello, Martha.
Are you hearing?
Hi.
I can hear.
Listen.
My question is, what kind of pain medication do you recommend for a person that suffers from multiple
sclerosis?
Osteoporosis?
So the question, then I will defer to Dr. Reich, is what type of pain medication would you recommend to somebody with
Osteoporosis.
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 Yeah, osteoporosis. Good question.
That's a great question, because osteoporosis is a relatively common problem, especially as women age, but also as men age. What is osteoporosis? Well, it's actually the thinning of the bone as folks get older, and again, especially women. And the difficult part about it is that it can actually lead to a bone fracture. Osteoporosis as an entity or as a disease actually does not cause pain per se. It's only when you do have a fracture associated with it. But with osteoporosis, I would keep the pain medication fairly minimal. Tylenol, aspirin, although aspirin can have its side effects, as can Tylenol, and also a Motrin-like or ibuprofen-like medication. So keep it fairly small. Remember, do always check with your physician if you start taking these medications after using them for 3 or 4 days. And if it persists, ask your primary care physician to refer you to a pain management clinic somewhere in the Bronx.
Right. So obviously the beginning course would not be any Oxycontin whatsoever.
Not even the last course.
Okay. Dr. Reich, why is this pain management program that you've started so important to our community?
Well, it's different. That's first and foremost. Historically, pain management was a lot of sort of interventional modalities where they're injecting things and sort of a bit of manipulation, but a lot of injection, and often leading to surgeries and procedures. So what we've done is we look at pain as something quite different, and especially because of the problems that our community, our patients, our community are bringing to us. Osteoporosis being one, osteoarthritis being another. Very common problems. Old fractures, sprains and tears, and these types of problems. So as a result, because those are the types of problems people presented to us, we said, rather than using a lot of medication, let's do something a little bit different, a little bit less traditional. That's why we're unique.
Right. Okay, let me ask you a question that Mr. Schnee wants. How is the comprehensive pain and integrative health practice different from other pain management programs?
Maybe Mike wants to take a stab at that.
Sure, I will take a crack at that one. Yeah. So we do, I like to think, 2 things different than a traditional pain clinic. One is education. We provide education not only on the epidemic, but on the medication and more detail on a type of pain you may be experiencing. Yeah. The second thing we do is offer patients options. I've done a fair amount of research on...
We're going to interrupt you a second. We have Alberto on the air. Question, Alberto.
I lost him.
Alberto, are you with us? Hello?
We lost him?
Yeah. He'll come back. Alberto, he comes off. Yeah. Continue.
So to continue, the second option, or the second point is we give options to our patients, especially in the Bronx community. When you think of pain management, the first thing that comes to mind is pain medication. And going to the doctor and getting a prescription and refilling it at the pharmacy. What we do is shy away from that, and we give them alternative therapies. Again, we have our acupuncture, we have our OMT services, we have our joint injections, we have individual counseling, group therapy.
What about your patient population? Is it increasing?
The patient population has steadily increased over the last
I think we have Alberto on the air.
Hello?
Alberto?
Yes, doctor.
Okay.
Thank you for taking my call. My question is, who is more is it a man or a woman or a younger person or older person stands more of a risk to become victim to being hooked on the...
okay, who's more inclined to become victimized by the drugs? Men or women?
Or young or old?
Well, young versus old.
Young or old.
Young versus old, male versus female. I'll refer to Dr. Reich first.
Well, what is maybe not amazing, but it is absolutely the truth, is that with substance abuse addiction, It spans all socioeconomic groups, so it doesn't matter whether you. It spans all ethnic groups, all religions. You know, you walk down the street and you might see someone and say, that's a wonderful, upstanding citizen, but they may have an addiction problem. You may, so it doesn't matter. And as far as men versus women, we see it more commonly in men, and sadly and unfortunately, it's all sad. We also see it in younger age groups now. Late teens, early 20s, into the 30s.
I'm going to interrupt you on that note because I want you to share with our viewers some of your success stories.
Absolutely.
Our viewers love to hear about success.
So we love doing that. And so one in particular was a young person, a 28-year-old. And last time I was here, Mr. Schneer, Dr. Gums, I got to talk about our community health workers and their success stories. Well, it was actually with the help of one of our community health workers. Young man arrived in the pain management clinic, had been seen one time in our emergency room, and they sent him over, homeless, was not from New York State, was actually from another state, and through a series of efforts by one of our community health workers, not only was seen in the pain management clinic that day, was referred within a week to our detox program, spent 3 days in detox, was discharged, didn't make it into a rehab program right away, but within a week was at the Bronx Lebanon Hospital Center, Life Recovery Center, outpatient rehab program. And
he's doing very well.
Now has a solid home, a home to live in.
Okay. Now, before we close the program, where is your program located?
Oh, there you go, Mike.
And how can individuals in our community get an appointment to see you?
So we are located at our Fulton campus, 1276 Fulton Avenue, between 168th, 169th Street. We are located on the first floor of that location, and you can call by calling the main number to the hospital, 718-590-1800, and asking for an appointment with the pain clinic.
Okay, very good. Well, let me thank you, Dr. Reich, and you, Mr. Slidensky, for joining with Dr. Gums and myself on tonight's Healthbeat television program. And most importantly, let me thank you, our viewers, for tuning in this evening. You will continue to be a most important part of our Healthbeat television program.
If our viewers have any questions or need assistance, I encourage you to call our physician referral service. That is dialing 718-99 Bronx. That's 718-92 7669. Or you can refer to our website at bronxcare.org. Good night. We'll see you next week.